Hello everybody, welcome to my YouTube channel. My name is Shiva Ravindra. Today I am going to discuss class 57 handling dual CTCA grade for the calcium. So even the not a calcium, if any parameter having the dual responses, so that time how can we derive the lab records in the ADLB? Okay. So here before that one, what is the CTCA? Common terminology criteria for adverse event. It is mainly used in the oncology or other clinical trial to give the gradings to the lab parameters and gradings to the adverse events. So the range is for 1 to 5. So mild, moderate, severe, life-threatening and death related to the adverse event. And in case of laboratory, based upon the value and the ranges of low level and a high level, so they will give a grading. Okay. So here one of the hemoglobin, if it is a low, so the gradings are like this. If it is a grading 0, for the females, it should be low level. The value and it is a main if it is a greater than or equal to the low level. Okay, so low level to 10, the grading is 1 for the female and same for the male as well. Okay, so like that, the criteria was defined in the common terminology criteria CTCAE grade document. So for example, subject is a female and the low level normal range is 11.5. So the baseline is 11. Okay, that is a grade 1 because 11 is a grade 1, right? So worst post baseline is 7.2 grade 2. So what happened here? So 1 to 2, so this is a upgrade because grade 1 to grade 2 it was moving, so it is a upgrade we can consider. So in case of calcium, what happened? So there is two is definition. One is hypokalemia, hyperkalemia. So what is hypokalemia and hyperkalemia? If the lab parameters have only one definition in the CTCA grade, if that is fine. But some parameters have two dual responses. If it is low also one disease and high also one disease. So in that cases, what we need to include two records in the Adam level. Okay. So for example, if it is a low, that means what? The calcium levels, it should be low. Okay. So if the high means the calcium level is high. So here the baseline is 2.3 and post baseline is 1.6. That means reducing, it is a hypo. Here 2.5 and post baseline is 3.4. That is means increasing the value. Okay, based upon the criteria, the grading also increase. So before baseline grade 0 and post baseline grade 3. So upgrade. So here upgrade also there, but the value you can see that value is reducing as per this here. So here in that cases we have to create a two rows. CAL calcium Cl means calcium low and calcium high. Okay, CTCA grade low and CTCA grade high. Like that we need to create a parameter and weak for the subject having low and weak 8 the subject calcium parameter is high. So dual abnormality cases, we have to include the two records. And you can write the coding like this. If the calcium is a param CD, in case of hypokalemia, aval should be less than the LLN value. Then we need to define like that. If your value of the param CD calcium is greater than the upper lower normal range, upper limit normal range, then we can give as a parameter like high. So some of the other parameters having also dual abnormalities like calcium, potassium, sodium, glucose, magnesium, phosphorus and bicarbonate. So these are the parameters while handling in the Adam level of the CTCA grading. Be careful like whether it has any two abnormalities or one abnormalities. You have to write the coding in such a way. Okay. So the interview panel members will ask you if your parameter having a two types of abnormalities, how can we handle? Give us some examples. Okay. So you can explain the calcium hyperkalemia and hypokalemia. Thanks for watching this video. If you are interested, please subscribe my YouTube channel. Thank you.